So you have autoimmune disease and you're now a missing tooth. What are your options? Autoimmune conditions are a condition where the body starts to reject part of its own body. So for example, in eczema, because of sweat, the sweat that produces inflammation, and that causes lots of dryness of skin, peeling of skin, itchy skin, dry skin, and redness of the areas. A more advanced version, where there's, for example, psoriasis, these are examples as to where some patients may be on some form of steroids, and steroids can affect bone healing. In fact, if a patient's been on steroids for a very long time, they can undergo what we call osteoporosis. And when osteoporosis happens, then the difficulty is that whatever implant we place, there's insufficient strength around the implant as the bone heals to retain the implant and make it suitable for eating. So what are your options if you have autoimmune conditions? You can have a standard titanium dental implant. Most of the time there shouldn't be a problem. However, titanium as we know it has a few problems of its own. Firstly, metal carries a negative charge. By carrying a charge, it attracts plaque. When it attracts plaque then allows for bacteria to come to the area, and with milk and dairy foods that you have in your diet, any form of calcification will cause that plaque to become calculous. And when that happens, then the implant starts to fail. Now, however, we do have options such as metal-free implants, or what we know as ceramic dental implants. One of the implant systems that I frequently use is a Xeramax implant system. It's in Switzerland. In this particular implant system, it's ceramic. There is no metal and there is no charge. As such, healing is much better because this implant on its own does not attract the plaque formation. In fact, if you were to remove a ceramic implant crown and take a look, the area is pristinely pink and usually has much less inflammation compared to that of a normal titanium implant. And in fact, some of the autoimmune patients as well, because of the autoimmune condition, they start rejecting titanium. And of course, titanium allergy is real. So far, there's very little documented evidence of people being allergic to ceramic. By and large, if someone is potentially allergic to titanium, a ceramic implant is the next best option.